Okay, perfect. So with that end, welcome and let me do some introductions to our presenters today on the topic, Public Health in Action, Partnering with Communities for Change from the City of Brooklyn Center. So we have Christina Jones. Christina has served as the Community Engagement Specialist for the City of Brooklyn Center for the past year and a half, enjoying building strong community connections and partnering with local resource organizations to improve community well-being. Prior to that, she spent several years with the Brooklyn Center schools, including roles as a due process coordinator and attendance clerk, and 2 years as a health outreach specialist at the School Health Resource Center. And then we have Armando today. Armando Oster and the Community Engagement Coordinator for the City of Brooklyn Center. Armando has worked in this role for more than 5 years. He has been an educator and a youth coach for more than 15 years. He values relationship building, collaboration, and volunteerism. Welcome to you both. Thank you so much. And I'll pass it on over to Christina. Thank you so much. Here you go.
All right, Armando was starting it off. Armando, do you want?
Hello, everybody. My name is Armando Oster with the City of Brooklyn Center. I just wanted to pop back on here and turn my audio on. I'm going to share my screen again. I'll introduce myself as we go, and Christina will reintroduce herself as we're going to be bopping back and forth. So thanks for being here with us. Thank you to the Minnesota Public Health Association for inviting us in, and to my colleague Christina for making this happen. Thank you, Christina. All right, gonna share my screen. Not the most tech savvy person, but I'm gonna try here. So. All right, we're here to talk about the Health on the Go program at the City of Brooklyn Center. The Health on the Go program staff, as was shared before, myself, Armando Oster, I'm the Community Engagement Coordinator, here with my colleague, Christina Jones. Our team is rounded out by Raquel Gutierrez, who is our artist in residence. She is our everything to do with art, whether it's for healing or public engagement. She also leads a lot of the parks initiatives, Adopt a Park, for example, and Adopt a Garden as well. And then, of course, Director Latoya Turk. She is the director for the Office of Community Prevention, Health, and Safety, and guides all of us in our work. Briefly about Health on the Go and a little historical perspective. So Health on the Go has been around since 2020. There's an organization in Brooklyn Center that helped really get this going. And the idea was to see how we can work better with cities and then local organizations and other community partners to bring health to where people are, whether at their schools, churches, community centers, etc. So the program launched in December 2020, coincided with the COVID pandemic. City of Brooklyn Park and City of Brooklyn Center have their own programs. Hennepin County heavily involved as well as another partner, and locally in Brooklyn Center, the Brooklyn Center Community Schools Health Resource Center had dedicated staff. Christina, actually, in her prior role at the school district, was involved in Health on the Go with both Brooklyn Park and Brooklyn Center. During this time, Health on the Go in the City of Brooklyn Center was led by our recreation department, so staff that are not under the umbrella of Christina and I. And right around 2023 is when the Office of Community Prevention, Health, and Safety was in charge of Health on the Go as we know it today. Some highlights between 2020 and 2023 from the beginning of the program to when it came to our office was that we collaborated with Brooklyn Park in their program, the county, and the schools. Brooklyn Park really led the way early on. They had a colleague of ours. Her name is Carmen Bibiano. She was the Health on the Go lead at the time, and she was actually visiting different apartment complexes and was cycling through with community partners to bring services directly to community, which is something we're circling back to in Brooklyn Center to see if we can realize that with community partners going forward in 2026. Um, Again, this is not city led. It's more of community influenced. So I'm going to go to the next one and hand it off to Christina to kind of go over some demographics to understand the population that we serve.
Hello, everybody. This is Christina Jones. I'm Community Engagement Specialist for the City of Brooklyn Center. Brooklyn Center is the most diverse city in in Minnesota, including Brooklyn Park. So we're known as the Brooklyns. And Brooklyn Center is the most in Minnesota, creating a rich cultural landscape with unique health equity and considerations. There's a population of 32,811. Poverty rate in Brooklyn Center, 11.5%. Health coverage uninsured is 8.77 uninsured percent. Additional context, foreign-born population is 21.5%. U.S. citizens, 89% of our residents. Over 1/3 of families and children under 18 live below federal poverty levels. High housing and cost burdens, over 30% of income towards housing. So one of the things we did do is when we do our outreach and events and tabling events, we put out a survey, and we noticed in the survey a lot of people, when we ask community members, what are you looking for in the city? How do you want to see? What kind of support do you need? One of the number one things was housing, because affordable housing is not is not realistic right now. And seeking jobs, and people, it's not that people don't want to work, but it's like the job is not fitting what we have to spend to survive. So I was hearing a lot of that from community members. Key health disparities in Brooklyn Center. Our BIPOC health inequities, 68.7%. Non-white, Black, Indigenous, and people of color communities experience health disproportionate health outcomes. Brooklyn Center's diverse population faces higher rates of chronic health and reduced access to healthcare services. One of the things we do have is when we go to our table events, we also our director, who's also a registered nurse, or we contract nurses out. We have med pods. These med pods, and you'll see later on one of our slides, we can take blood pressures with the med pods. We can take temperatures. We can do height. We can do weight and your oxygen rate level. And we noticed a lot of people of color were their blood pressure was high, and they'd even say before we'd even take it, "Yeah, I know it's going to be high." And we'd ask, "Okay, did you take your blood pressure meds?" "Well, no, I forgot." So yeah, we're noticing a lot. The blood pressure rate was really high with a lot of our community members. And we also sometimes we contract out a doctor too. So if people have questions, they can ask a doctor. And we made sure that our doctor is he is African American. So we noticed that a lot of our community members were more comfortable and would get excited when they're seeing that our nurse and our doctor was of color. So that helped to break down the barriers, because a lot of community members, when they hear you work for the city, it's like, so we had to to get their trust, we had to no, this is what we're doing. We're here to help you guys. We're not here to, we're even though we work for the city, we're here for the community, and we instill in them that the city works for you guys, and we need to know what you want and what you need from the city. And we noticed that there's limited prevention care. Because I know our doctor would ask questions like, "Do you see a doctor on a regular basis about your high blood pressure, whatever?" A lot of population said, "No, well, I'm new to this country. I don't know how to get access to insurance. I don't know where to go for this." And so, yeah, we would help support with that too. Transportation was a big barrier. Limited public transportation. We noticed that many residents lack reliable personal transportation, especially elderly and low-income households, restricting their ability to reach health services. So when what Armando mentioned before, when I was working with the Health Resource Center, I also was working with Health on the Go Brooklyn Park and Brooklyn Center. So when I was working with Carmen Bibiano, one of the things that we did to offer is we offered we would go to senior housing, and we actually had somebody come out and they would do seniors that had diabetes and stuff. We actually had somebody come out and clip their toenails for them. And so we came to them, and we also offered vaccines, and had somebody to come check their eyes to do eye exams. And that too, we offer too with Brooklyn Center. One of the things we do for our Health Resource Center, we offer free vaccines, especially for our back kids. That's why one of the reasons we have our resource fair in August, because that's around the time where kids have to get their back to school vaccines. And then we also offered free eye care through our partnership through Lions Club Eyesight. So that was a big plus to have kids be able to get their eyes checked at our health fair and get caught up on their vaccines.
The only other thing that I would add is the transportation barrier. One actionable item that we initiated this year, just this week, we completed the application for reduced fares for Metro Transit. Brooklyn Park is already signed up for it, and yeah, we found out about it recently, and we're just waiting for the results of that. So people who it's income based, and you do a verification. There's a process that you do, but it offers people pretty reduced fares for at least the bus if they don't have a car to get to work or to wherever they're going. So
and without our success, we need partners. So our partnership has been very important to this initiative. So Health on the Go partnership networks include ACER, Brooklyn Center Community Schools, and Health Resource Center. So our last couple of years, our health fair we've had it at Brooklyn Center High School, and they've been amazing. So, and we really appreciate their partnership. CAPI USA, and of course the city of Brooklyn Park. Like I said, we're known as the Brooklyns, and then COPAL, and we have various other organizations.
yep. And the only thing I would add to that is with respect to the health fair, that's it's a city event, but we'll speak a little bit to it. With partnerships and in this discussion, we went outside of the box of the traditional at the City of Brooklyn Center for our departments, and we invited community organizations in to plan the health fair when I came on board in 2020. And for the 2021 event, that was the first time during COVID where we could have like an outdoor event again. And we went from 35 vendors to 70 vendors. For the past 3 years, we've had at least 65 vendors. In the last 2 years, we've hosted it at the high school.
Yeah.
So that's important to the city because we want to go where people are and are comfortable. And so we figured, hey, let's tap into the schools. And it's been really, really awesome because it's not just the high school, middle school, it's the elementary school, the alternative learning center, which is called ECA, Early College Academy. We know all the staff. Christina is the staff there, so she plugs us in too. So it's been a really, really awesome partnership. And it seems that they want to host it again. So we're going back. Traditionally
And
it's been hosted on city grounds. But yeah, go ahead, Christina.
And I was going to add on to and our people that come table, they're not just in Brooklyn Center, they're in Minneapolis, because a lot of our students that it's open enrollment school. So there we have students that actually live in St. Paul that come all the way to Brooklyn Center. So our partnerships don't just stop at Brooklyn Center or Brooklyn Park. We partner with people in St. Paul, Minneapolis, South Minneapolis, North Minneapolis, so and I feel, and we just feel the more we partner and the more we get involved with other community partners, it's better for the community. you know.
Yeah, and absolutely, and to really paint the picture. So how do we do this? So we work off of what we call a work plan. Some of you may be familiar. It's a document that you use that guides the work that you're doing. So for the city of Brooklyn Center, and especially for our office, we're guided by what city council wants us to do. So what we do is we take our strategic plan and we take parts of that strategic plan that align with Health on the Go, the initiative, the goals, and also the health fair, and put that on the top of the document. We also list our partners, everybody who's involved. And then the document also serves as different sections. So the communications group, the volunteer groups. So what that means is the partners that are part of the planning committee also are part of subcommittees such as volunteers, vendors, etc. And they take on actual responsibility for the day of the event. So it's not just city staff
Mhm.
doing everything. It's everybody who's in the planning committee steps up, and it was awesome this year to see it come together, because not only did we have Brooklyn Park with us again this year, but we also had the city of Robbinsdale community engagement
Mhm.
and also Golden Valley's community engagement
Yeah.
as well. So
And then one of our big partners that helped out this year for our health fair was Rechurch. We also we have a good partnership with churches here too. And we also where that also that's that also is part of mental health is church and religion and belief. So we've did table events for what was our Armando, can you remind me of our one with Nakoma, our last health resource center event with the church? Huh?
which church was it at?
The most recent one we did with Nakoma Naelka.
Oh yeah, yeah. That was
Yeah,
Brookdale Covenant, or Brookdale
Brickdale
Covenant
Covenant Church,
Church.
yeah.
Yeah.
And we were able to bring our med pods and we had our
Hmm.
doctor there. So yeah, and it was a nice turnout.
Yep. And so that's important because a lot of churches are right near parks where we do programming, and neighborhood meetings, for example, are another initiative that we lead for the city. So when you have relationships with a business or a church like right near where you're trying to do something, it is helpful to have them present at your or bring them into your event, to build some trust and just to see how you can work together. A lot of it is the church is reaching out to us now. Um, because Nyoka works for an organization in Brooklyn Center, so there's a second degree of relationship there, or that could be. So yeah. Next one, just a little bit of the numbers. This is reflective of, I would say, the past couple years for sure. This year, a little fewer events, but last year we were at 50 plus events. It was pretty crazy. But between Brooklyn Park and Brooklyn Center, we table at various events. So yeah, around 40 to 50 events every year. 10,000 plus community members engaged. There's few events that have like 1,000 people show up. Some we had the biggest event this year was 3,700, but that was a community event for Liberian Independence Day in Brooklyn Center. They're coming back again, probably going to be bigger. And then, but most events are smaller. So, but this is between Brooklyn Park and Brooklyn Center. And then 1,500 plus COVID-19 vaccines administered back in, it says 2022. So in 2022, I pulled this up because that's like during COVID, we actually put on two vaccine events in partnership with Brooklyn Park and some other community partners um, at St. Alphonsus Catholic Church in Brooklyn Center. St. Alphonsus at the time, I think, may still be the only Catholic church in the northwest suburbs that has Spanish Mass. I don't know about today, but that's what they told us. So they have a uh, pretty large uh, Latino population that goes to church there. So what did we do? We went to the church and said, hey, we'd like to provide this. Would you like that? Yes, we would. So between two events, we had 300 plus people receive vaccinations for COVID just for 2 events. So that was really cool. We had a woman named Stella Sola and her husband who work at the school. They're also interpreters. And they came and did interpreting for the folks there. We had also the administrator of the vaccines also had Spanish and English intake forms because we had very majority of Spanish speaking clients that day and those 2 days. So, but yeah, so that's
Oh, if
kind
you
of the
could go back,
snapshot.
Armando, I wanted to, if you can go back just once. This is the picture I was describing about our med pod. So this is our director, who's also a nurse. So this is an example of we have 2 med pods. And you and Armando, could you tell them like the how we were able to get the med pods? This was before I
Yep.
started.
Yeah, so we have 2 medical devices. We call them med pods, these things. Um, they do more than just basic wellness
Mhm.
checks. They can like you can connect it to where a doctor is on a screen remotely if you want or in person. And they have all sorts of stuff like skin grafting, like advanced stuff. So this thing could be used at like an actual clinic. And they were purchased through grant funding dollars through Blue Cross Blue Shield of Minnesota, and they are continue to be a grant funder for our division, our department. So Bukata Hayes is our contact over there. So we're grateful for that partnership and those funding dollars. So the cool thing about this MedPod, the device itself, is just because the city of Brooklyn Center Health on the Go has it, doesn't mean we have to administer it.
Right.
We've a couple of times, and we find that more community actually use the device when it's their nurses or doctors from their community that are administering the service at their event. So last fall, the Kenyan Community Church of Brooklyn Center, which is just down the way from us, right next to our a police department, actually, they had a health fair, and we're looking to plug in and get people to table, etc. And we were discussing the MedPod, and they were really excited. And we said, hey, would you like to have your nurses that you have from your community be trained in on this device, and then you guys can borrow the 2 devices for the event? And they did, and over 150 people participated in that service, whereas maybe 20 max at a normal event that we would be at would maybe do it, which for us is good, but
Yeah.
that's great that 150 people in one event, got a free wellness check. And it really is all because it was their event at their church with their community and
Yeah.
their nurses, right? And it's another level of trust. It's another level of breaking barriers, right? Is being open to maybe thinking outside the box a little bit.
Yeah. And like I mentioned before, we don't, and we have licensed nurses, doctors that actually do the med pods. So they're getting good sound medical advice. We're not just having anybody just going, oh yeah, your high blood pressure. Okay, go on. Stop eating fatty foods. Go on. No, we actually have trained medical people that actually work the med pods, and then they also give them good advice. And then we offer resources like if they need insurance or they need to go, find out where the nearest clinic, who offers insurance, who will take people in that, don't have insurance. So yeah, we offer other resources for them. And then our core services provided health services, COVID vaccine and testing, dental screening, HIV and STD testing, flu shots, blood pressure, mental health resources. And like our dental screenings and our HIV and COVID, those are from our community partners. Like one of our community partners that do that Red Door is amazing. They're in Teen Annex. They're another one of our community partners that offer HIV and STD testing. And then COVID vaccines, those have come from our community partners, and that would be ODAM as one of the community partners we have used at the health fair to give our vaccines. And then children's dental, they've did dental screenings at our health fairs. Food distribution, that's come from I believe, can you remind me, is it Cappy? Cappy has
Yes, yep.
yeah, they've rental assistance information. We've also worked with community partners with that. Health insurance enrollment. That's been through I'm trying to starts with a P. I know it's on the tip of my tongue. We work with them at the Health Resource Center. Yeah, essential food boxes. Another thing too is our Minnesota period kits. They're great. They I don't know if you guys have heard of them, but if you Minnesota period kits, you just go online and they will, if you say you need period kits, and they'll give you boxes of period kits. We have some stored in our storage room now, and those have been, the community members have loved them.
Yeah,
Um,
and they're
and it's
free. Still
and they're
deliver them
free.
to you as well.
Yeah, they'll bring them to you. Yeah, and they'll bring them to you or your portico. Thank you. That's, yeah, their health insurance enrollment. They also work with Brooklyn Center Health Resource Center. And yeah, we've partnered with Mittens and Gloves. They offer free gloves and mittens for our community members. So we distribute those during events. They're amazing too. So yeah, all our partners are just amazing. Some,
And I think the theme here is free. So these
yes,
services that you
free.
see at the health fair are free to the
Free.
community. You do not have to have insurance. Even through the MedPod, it's free, no insurance, no paper. Just you're there, you want it, great. If you don't, that's okay too. Also, the period kits are free that we get that we then give to community. So it's yeah, it's just trying to be cost effective, but also for the community as well.
And we, yeah.
Um,
And we've
it's
also
expensive
shared
out
like
there.
yeah, because like I'm sorry, Armando, but yeah, like during our last event at the church, the fire department, they were there at Brooklyn Center, and they were like, oh, we see those period kits, how do we get those? So I gave them a box and I said, hey, because they said and they were thinking, hey, this is a good idea when we go to different places and we can give them out to the community members. So yeah, so it's great to collaborate. Okay. Why mobile health? Mobile health clinics deliver exceptional finance return, making them highly effective public health solutions. Another reason mobile health networks directly contribute to extending lives through prevention care and health interventions. So yeah, when you have mobile health and more people that are not able to, when the healthcare comes to them, they're most likely to get the help that they need for them to go and go to the doctor. So when it's easier for them access to go, and sometimes sometimes when people go get their blood pressure checked, they don't realize it's high, until somebody, but they never think to go, let me go to the doctor and check that out. So sometimes that pushes people to say, hey, my blood pressure is high. And and we have our doctors and nurses say, hey, there's some suggestions or some places you can go. And so that's the big thing, is prevention care. And then our mobile health demonstrates substantial economic impact across nationwide implementations. And then Armando, can you scroll down a little bit? I think.
Oh, maybe I'll have to.
Okay, it's fine. So it also reduces access barriers too. So like Armando mentioned before, sometimes the bus, some people just with the bus, they might not have the money to get to the bus, so it's good. And so when we have mobile clinics, or if they don't have a car or transportation to get there, it reduces access barriers to community members when we are able to bring the mobile health to their neighborhood, their apartment, or their local parks or events or schools that are near them.
Yeah, and I would say that one of the most effective programs that I've seen so far was from actually our partner Brooklyn Park, who went to the apartments. They did
Yes.
various apartment stops. Uh, there's just more people there that you could interact with and in one stop, right? So again, that's what Brooklyn Center is looking to do with the 2026 programming. But
And
yeah.
And I
Should I go to the next one?
personally
Oh,
witnessed it when I was working when I was working my grant funded position working with Brooklyn Park Health on the Go, like, and the residents will look forward to it. Like when we would leave, they're like, okay, you're going to be back next month, right? At this time, I was like, yep, we are. Especially our senior community. We also offered food distribution, but the fact that they were able to come and just come out, just had to come out to the parking lot. And they were having, people with diabetes had, they were able to get their toenails trimmed or able to get their flu vaccines, because it's important for seniors to get their flu vaccines and their COVID tests without having to worry about scheduling transportation or having somebody come get them, or if they weren't able to drive, or if they just weren't able to take the bus. So yeah, it makes a big difference. And
right.
so
And
oh, go
yeah,
ahead.
and I was just gonna say, just I clicked onto the next one and looking at this, our artist in residence is Raquel Gutierrez. I won't read all of this to you, but I'll let you kind of scan through it. I'll just speak. I know you guys are going to talk about Indigenous Heritage Month. I'll kind of tie that into the conversation here with our artists in residence. Raquel uh, really helped lead the way with putting on programming for City of Brooklyn Center community for Indigenous Heritage Month this year. This is our first time celebrating Indigenous Heritage Month, and we partnered with Leah Hale, who is a filmmaker and works with uh, Twin Cities Public Television. Uh, she made this film called The Electric Indian a couple years ago, and we featured that film, and we had a Q&A with her. We also had our artists in residence made the connection also internally and externally to get this going, and also really focused the conversation on bringing in American Indian internal staff who were a part of the process to guide us in putting the program together. Also bringing in Leah and helping with that conversation as well to make sure, everything was in place, that the programming followed in a way that was culturally sensitive and relevant uh, to the community that we're trying to honor. So, um, but our artist in residence, as I said before, briefly, she covers everything from murals in the city that have gone up to art during the health fair. We had I think like 150 participants from the community contribute to a mural piece that Cadex Herrera, a local artist, we contracted to do the mural for. So that was featured at the health fair. Um, and art therapy, you could do your own research on that. Um, has been shown to be really helpful in this space as well. So, Christina, do you have anything to add?
Yeah, art I mean, it's been amazing, and I truly believe that art, and we're trying to with the art piece, we also know that's very important with mental health too. So it's been shown that it helps with anxiety and depression, and it also helps with people not to feel so isolated when you're working together on something and creating something beautiful. And I've witnessed at different events, just having community members that never even met each other just come together and just work on this art, and you see all the laughter and just kind of people just and it's not about, like, you don't even have to be an artist. It's just about just going and just having fun, and it just brings people together.
Mhm. All right. All right. As you can see here, there's a few things listed, but really going back to what we were talking about before with the health fair, that's probably that's our biggest event at the city, next to maybe Juneteenth, and bringing in community to the table to actually plan the event has gone really well. I think using the model with the work plan as that's what we're working on. It's not Armando or the city, dictating. It's no, we're working on this, and how are we together going to make this work? So community as experts, we follow the IAP2, and that is an international organization for public participation. And they have at like 5 levels of engagement, they call it. And from the basic informing people, that would be like, there's a health fair tomorrow. Here's a flyer. Bye. 2, bringing somebody into a planning team and developing the program together and having community actually lead right together to produce something such as the health fair is like the 5th level empowerment. And then another level of empowerment is the community actually taking over community meetings and leading those and bringing other community together and addressing issues. That is another example of empowerment for community leading the way. Cultural humility comes with the partnerships because there's so many different people in Brooklyn Center that you can have representation from a vast array of people and backgrounds. Trauma informed approaches, that comes from our leadership. We have our director Turk, who has a nursing and public health background. This is her jam. And folks like me, I work in engagement that is a division of the Office of Community Prevention, Health and Safety. So Christina and I support those broader initiatives, and the health fair really brings it all together for us. And the collaborative decision making is what I've already said. So, and really, yeah, it's been a really interesting 3 years with the health fair and the planning committee. It just gets bigger and bigger. And the quality has stayed, meaning we're still getting services to community. And now it's how can we partner better with our community partners to get the word out more. We're consistent. It's been 5 years, but now where do we go from here? So.
And so our 2023 strategic priorities, increase collaboration, develop long-term planning structure, and create assessment and evaluation plans. So we want to strengthen coordinations between cities, community organizations, and local authorities to streamline service delivery and maximum resource effectively. Because one of the things too is, and also developing long-term planning structures. And that's really important because I know in this field, a lot of our roles are grant funded. So we have to figure out a way how we can do this, not for the short term, but the long term. Because just because we were able to provide these services for our community members doesn't mean, okay, we provide this community service we provided the free vaccines this month and and provided food and provided all this information and stuff, but doesn't mean, okay, but the grant's over with, that means the problems disappeared. No, it's still going to keep going. So we're working to, we have to work to develop for the long terms, because this is not, our community is always going to need our assistance. So we have to figure out a way for this to go long term and not short term, and to keep this going on, because we one of the things that our community members, they sustainability, because that's one thing they were like, okay, are you guys doing this next year, and and are you going to continue to do this, and so it's this it's very I love what I do, but then I also am like, okay, how can I keep going? How can we keep this going? Because I was like, we're always, this is something we need for the, to keep going. We want to all continue, our seniors are going to continue to need assistance. Our families who are in low income housing, or in a situation where they need the help, they're always going to need that assistance. So how can we keep all the funding going and the programs going?
So we put the 2023 strategic priorities is because we received, well, Health on the Go
Yeah.
was, its new home was the Office of Community Prevention, Health and Safety. So we created a strategic priorities. That's really hard to say.
I know, I
In
was trying to say
2020, in 2023. So that's why we have it on the screen now. And 2026, we're working through new strategic priorities within the city itself. For long-term planning structure with our staff and all of our departments. So I already mentioned the increased collaboration from 2023 till now. We've increased that collaboration, especially with other cities. I mentioned that Brooklyn Park, Robbinsdale, and Golden Valley are now involved in the planning and scope and sequence the day of the event now. As well as community partners. There's new ones that come and join every year, which is kind of cool. And then long-term planning structure for Health on the Go, specifically for Brooklyn Center, is really predicated on our partnerships. For example, the Brooklyn Center Community Schools is now looking at hosting the health fair yet again. That's a positive. They could say, no, we don't, this didn't work, right? This is not good for whatever, but it is, and it has been. So we're doing something right there. It also strengthens our trust and also relationship building with the staff at the school district within the city. And then the assessments and evaluation plans internally between 2023 and to date, we do we survey our partners that are on the planning committee. We also ask our participating vendors some feedback for our event year to year to make it better year to year. And yeah, we actually look at that stuff too and talk about it. So, and that's why we've been able to grow, because we've taken that feedback and done something with it. So recommendations and next steps. I'm kind of talking about it now. I won't read all this to you, but there are year to year, there's always going to be changes either in staff or we work for a city. So could be your city council, but really it is about partnerships. It's about a regional approach now to public health. We cannot do it alone. It's impossible. We need to work together. We need to lean on each other's strengths and collaborate together to expand our reach to many different communities that we serve. So, but here's just, some information there. We can share this, the PowerPoint, with everybody after the meeting.
Okay, and discussions and call to action. Invest in program expansion, support sustainability planning, strengthen partnerships, expand community services. So I'm not going to read all this to you, but yeah, but yeah, we know that in this field and working with community members, it's always when we go out and we table and we talk to our community members, and the biggest thing and we instill in our community members is, hey, we work for you. We encourage them to go to the city council meetings. We ask them, please, and when we ask them to do the surveys, we say, oh, we just want to know what can we do to help support you better? Because if we don't know, we can help you. So this is about you. So that's one of the things we want to empower our community members, because at the end of the day, they live here and they need to, feel they're part of the community. They are the community. So, Armando, would you like to add anything onto?
No, I think I'm going to stop sharing my screen so I can see everybody again.
Yeah.
I'm sorry about the background noise up there. So
Okay.
I know that was a lot, but we're here. I know Miss Christina, I know you have to get going, but I am able to stay for questions and to be with you all. Thank you.
And I know we had some.
That was amazing.